All right, let's welcome back Sarah Farmer, Director of Testing and Evaluation of Center for Advanced Communications Policy at Georgia Tech. Sarah, can you hear me?
I can hear you.
And I can hear you. All right, at its highest level, talk to me about this technology that we're talking about that could help in the childbirth care.
Yeah, so we underwent this research because, as you know, pregnancy complications and maternal mortality is an issue in Georgia, particularly in rural areas as well as across the nation. And we believe that there's a prime opportunity for technologies to improve patient outcomes and increase the safety of mother and baby. But past research has shown us that there are barriers to adoption of the use of these technologies, both for patients and healthcare providers. So our research has shown us that these technologies and the adoption and use of them often hinges on the patient healthcare provider relationship. So as we did this research, we really wanted to better understand the relationship and the attitudes toward technologies for both of these groups.
So talk to me about, I got you. Talk to me about why now and what's changed in the technology to make these better outcomes happen.
Exactly. Wearable health technologies, and just for the viewers, in case you aren't familiar, the most basic example is kind of an Apple Watch or a Fitbit. So it's any device that you can wear on your body that's collecting and monitoring health data. So Fitbit, Apple Watches are sort of on the consumer side, but then there's also medical grade devices that can be used as well. And we really, the research community is creating new sensors and new capabilities all of the time. But if there's this disconnect between women actually wanting to wear these during labor and delivery and healthcare providers, buying into the adoption of these technologies, that's kind of where the barrier is. And that's what we want to understand. So that as these new wearables and technologies are created, that hopefully women and healthcare providers are actually comfortable using them and trust the data that's coming out of them.
Where do you see the real world usability breaking down most often in these early prototypes?
Oh yeah, so there's a lot of different things going on. So often there's mistrust of the technology.
Mm-hmm.
There's a lack of adequate training and education. So both the healthcare provider side, they need to understand how to use these technologies. They need to have support if they're troubleshooting. And the same for the women. They really need to understand the utility of these devices and, understand why this data is going to help keep them safe and help keep their babies safe. But beyond that, there's often cost. There's concerns about privacy and security. So it really is the whole system that we have to look at here.
So you guys have done a focus group. You've talked to these mothers. What have they been saying about this, especially about privacy concerns? What else have they been talking about?
Yeah, so we surveyed 4,500 women and healthcare providers across the country, and then we did focus groups with 110 of those individuals, and they have so much to tell us. So we found a couple of interesting things. Women tended to want, when we asked them what measurements they would want to get out of these wearables, they tended to want the more familiar measures that we're already kind of seeing in wired technologies. So things like blood pressure, maternal and fetal heart rate, fetal movement, things like that. Whereas the healthcare providers are wanting that cutting edge data. They want new, data coming in. They want to kind of go beyond what's the standard of care. And so that in itself is kind of a mismatch, a gap, because the women have to buy into these as well. And so I think that is part of the interaction and the relationship between healthcare providers and women who are pregnant, and understanding that relationship and how healthcare providers can provide the information that women need, and help them build trust and things like that.
So I have about 15 seconds left. If I got a mother watching right now, what do you want to tell her about where the technology is headed?
Where the technology is headed, I think that the opportunity to help women is really there. So understanding, again, where the barriers are, help them understand that there's new technologies and devices, and sometimes that can be a little bit scary, but these are being designed to help them, and we hope that we're able to improve patient outcomes.
Absolutely. Sarah Farmer, thanks so much for joining us. Really appreciate it.